At that time, I thought for certain I was going to die.
After spending nearly months in the ICU, a local healthcare worker who tested positive for COVID-19 is sharing his story. He spoke with ABC 10 News reporter Nate Holmes about his struggles with recovery and the message he has for others about the virus.
COVID is actually real. It's not a fake.
With tubes and wires everywhere, Ezekiel Melendez Jr., also known as Zeke, spent a total of 57 days in the intensive care unit after contracting COVID-19. The respiratory care technician says he's always been an active and healthy person with no underlying health conditions, but it all started with flu-like symptoms.
I didn't meet the criteria at the time for COVID testing. You were supposed to have a temperature of 102. Mine was only 100. So they sent me back home, told me don't go back to work until 24 hours without symptoms.
7 days later, his symptoms got worse.
Next thing I know, I'm laying on a gurney, preparing for intubation with an endotracheal tube.
Girlfriend Grace Carbajal, who is also a healthcare worker, says it was a challenge seeing him sick.
Being a nurse and not being able to be there at the bedside, also being a loved one and not being able to be there for him and with him was very difficult.
After spending weeks in the hospital, Melendez was released in late May, but he says it will be a while until he feels like himself again.
Not easy. I wake up with pain every day.
Melendez is still under doctor's care and has physical therapy weekly. He has a message for everyone as the pandemic continues.
We need protection and everyone doing their part to wear masks. I was one who thought it was just something like the flu, maybe exaggerated at the time. And when it happened to me, it was a smack to the face.
Nate Holmes, ABC 10 News.
Melendez would like to thank everyone for the support and to those who donated to the GoFundMe that was created while he was in the hospital. The money is being used for medical expenses and physical therapy sessions.